thick.
You start that over.
Ugly, yes.
Okay.
Are you filming? What?
Yes, because I won't remember what to
Okay,
tell my
that's
husband and
fine.
my mom.
So there was thick pus that came out of that area, okay? So what our theory is of what happened is you had a flare-up of your ulcerative colitis. Because of that flare-up, the appendix lies right near that area. It probably sealed off that opening of the appendix, allowing it almost as if you had, a fecal matter or something that often causes an appendicitis, caused an inflammation in that appendix and then caused the rupture of that appendix, okay, and that's what formed this abscess of bacteria in
But
that
my
area.
appendix didn't actually rupture.
It very well could have, okay?
Oh.
He asked the radiologist, he said, what did the appendix look like? Was that the exact thing that caused it? He says, because there was no oral contrast, he said, I can't get a good see, because the appendix is very, very tiny organ, and he couldn't tell exactly if it was exact from the appendix or not. So it would need to be an oral CT with oral contrast at some point. But that, either way, it would be treated the same way. We would never rush to surgery. We'd say, put a drain and drain it out. So because of that, like I said earlier, his thoughts are you'll probably be here at least 2 days, possibly get out Friday, okay? We need to wait for those the cultures of the pus to come back to say, okay, what is it, what's the bug, what oral antibiotics treat it? And also then how we're dealing with the steroids, okay? The ultimate discharge is the hospitalist, because they're kind of the captains and we're here from a surgery standpoint. Do we need to do surgery, do we not, what's going on? So they'll ultimately make the decision, but our gut feeling is that it'll be about 2 days before we get all that information back and, kind of work with the steroids and allow everything to keep working the way it needs to work.
So for now, while I'm here, am I on IV antibiotics or oral?
I will see what is she on currently for antibiotics?
Oh, antibiotics? Yep. Q6.
Okay, yep, we'll stay on that at this point.
Does that mean
That means
IV?
IV, yep.
Okay.
Yep, you're on a very broad spectrum at this point, so it covers a lot of bugs, and those cultures will allow us to give hopefully targeted oral therapy to get rid of those.
So now that I have all the pus is gone, will my
We're expecting your
healing?
Exactly, we're expecting your white blood cell count now to begin to normalize because it was been riding high. Now of course you can ride high with steroids. However, that's why with you clinically doing not improving the way we want it, that's why he said this, we need to do this. And with pus coming out that you did have an infection in there. And so we're expecting your white blood cell count now to start trending downward.
Awesome.
And everything to kind of work back to where we're
And
back to
then
baseline.
that pain and tenderness that I have on my right side bowel will dissipate with the absence of pus.
It will. Now you do have a drain in, so you will notice some pain where that drain site.
Okay.
But the fact that you had
It's
that
probably nothing
that
compared to what it was.
increase in
So
pain, that's why he said we can't just stay the course. We need to find this might be an abscess. We need to go in.
okay.
So yeah, he did say put her back on a regular diet though. So if you're okay with that clinically, and I think you're
100%.
feeling good, you're hungry, right?
I'm so hungry.
Okay, all right. So we'll get her
Dinner's
back on.
almost here, yeah.
Yeah, we'll get you back on regular diet. Okay, just kind of go from there.
Thank you so much.
Alrighty.
I appreciate it.
Yeah.
Thank you again for your dietary notes.
Oh yes.
Like I talked to my mom on the phone this morning and she was like, wow, I've
Okay.
never had.
So just reinstate the one I had in there, which is a regular diet,
Okay.
but it allows her to pick
Okay.
because of her ulcerative colitis.
Uh-huh.
She knows what her body handles better,
Very good.
and so it'll allow whatever they've been doing has been working.
Perfect.
Yeah.
So yeah, and it's on the whatever one I put in, it's in there. So
Excellent.
awesome.
Thank you.
Thank you.
All right.
Have an uneventful night.
Thank you so
Okay,
much,
besides some
Matt.
good food. Okay.
Thank you so much. I
Yeah,
appreciate it.
Thanks, Matt.
Yep.